Hello, today is the 42nd day of 365 days project and let's see the causes of diarrhea. Through infection. Diarrhea is a symptom of infections caused by host of bacteria, viral and parasitic organisms, most of which are spread by feces contaminated water. Infection is more common when there is a shortage of adequate sanitation, hygiene and safe water for drinking, cooking and cleaning. Retrovirus and E. coli are the two most common etiological agents of moderate to severe diarrhea in low income countries. Malnutrition. Children who die from diarrhea often suffer from underlying malnutrition, which makes them more vulnerable to diarrhea. Each diarrheal episode in turn makes their malnutrition even worse. Diarrhea is leading cause of malnutrition in children under 5 years old. Sanitation. Water contaminated with human feces, for example, from sewage, septic tanks, latrines, is a particular concern. Animal feces also contain microorganisms that can cause diarrhea. Malabsorption. Malabsorption is the inability to absorb fully food, mostly from disorders in the small bowel, but also due to maldigestion from disease of the pancreas. Causes include enzyme deficiencies or mucosal abnormality, pernicious anemia or impaired bowel function due to the inability to absorb vitamin B12, loss of pancreatic secretions, which may be due to cystic fibrosis or pancreatitis, structural defects like short bowel syndrome, certain drugs like orlistat, which inhibits the fat absorption of fat, inflammatory bowel movement disease, which is caused by ulcerative colitis and Crohn's disease, irritable bowel syndrome. Another possible cause of diarrhea is irritable bowel syndrome, which is IBS, usually present with abdominal discomfort relieved by the defecation and unusual stool for at least 3 days or a week over the previous 3 months. Other disease. Other disease are chronic alcohol ingestion, hyperthyroidism, certain medications, bile salt malabsorption produce secreted diarrhea, hormone excreting tumors, some of the hormones or serotonin can cause diarrhea if excreted in excess. When to see the doctor? Diarrhea often resolves without medical treatment, but it is important to seek medical help when there is persistent vomiting, persistent diarrhea, dehydration, significant weight loss, fever of 1 or 2 Fahrenheit or higher, pus in the stool, blood in the stool, which may turn the stool black if it is coming from higher to lower in the gastrointestinal tract, urinate very little, experience abdominal and rectal pain. Anyone who experiences diarrhea after surgery, after spending time in hospital, or after using antibiotics should seek medical attention. Adults who lose sleep due to diarrhea should also seek medical care as soon as possible. This is usually a sign of more severe causes.